Now, a lot of advances have been made in joint replacement surgery in recent years. The most well-known of those, I think, is probably the anterior approach to the hip. I've been doing that for about 4 years now, and it has really revolutionized the rehab for total hip replacement. It's the same operation. It's not a different operation, but it's a different way to get to the hip to do that operation. And by using an anterior approach, you can go down between the muscles and just spread the muscle apart, and you don't cut any muscles during the procedure. It also facilitates the use of X-ray during the procedure so that I can make sure that the components that I use are in the right position and that they're the right size. It helps with determining the length of the leg because I can compare the X-ray to the other side of the hip and try and get the leg length just right. It has reduced my hospital stay to one night, and so that I typically will do a total hip on Tuesday morning. The therapist at the hospital gets the patient up Tuesday afternoon, and by lunchtime on Wednesday, they're ready to go home. And it's not uncommon to see the patients come back in their postoperative period at 8 to 10 days, and they're already ready to get off of their walker and just doing marvelously well. Well, total shoulder replacement is, again, much more common. Typically, that is a one-night stay in the hospital. My patients will just use a routine sling for about 4 weeks after surgery. Before they go home, the day after surgery, the therapist sees them and starts them on some motion and some exercises for their shoulder. It takes about 3 or 4 months to really say, okay, I'm glad we're done with this and I can do more things. But shoulders can improve really up for 6 to 9 months because there's so much motion in the shoulder, it takes a while to recover that motion and make it more functional. With total knees, I think most patients will say it takes about 3 or 4 months to be done. But by that time, they're back, they're shopping, they're working, they're doing the things that they want to do.